Dr. Alex Earle here, and it's Hump Day with Dr. Alex Earle. We're here at Pure Plastic Surgery, and do you guys miss me? Huh? I know. I am so sorry. It's been about a month since our last Hump Day Live. Well, I took a well-deserved break, and then I was meant to come back last week, and it just got too busy. We were just completely slammed the first week. Actually, all of January is extremely busy. Ton of cases. Ton of people to see. It's been actually very exciting. We hit the ground running. But yes, today we finally made it for the first Hump Day of 2025. And some of you know me, some of you may not, but what we do here is that I go over plastic surgery topics and I answer any and all of your questions, plastic surgery questions or questions about me. That's okay too, all right? And you know you're getting great information because I am a Ivy League educated, Duke trained, double board certified plastic surgeon, okay? All right, so what did I choose as my first topic for 2025? Well, I chose something that is a little bit of a pet peeve and something that comes up many times. And you know, I took my break for the holidays. Of course, I'm like scrolling and looking at things, and I keep seeing these tummy tucks that you know, they're just not good, right? They're just not good. And I'm like, what is going on here? And why are these surgeons doing this, right? So tummy tucks that end up being way too boxy. And the other thing are tummy tucks where the incision is just, I don't think it's well placed, right? And so this is something that I've been working on, of course, for many years. I think, I really come out with a great technique. And so our tummy tucks here at Pure Plastic Surgery, we bring out those curves. You have that nice hourglass shape, and the incisions are placed, I think, in a way that they're very easy to hide, okay? So that's what we're going to talk about today. We're going to talk about tummy tuck incisions. And so when we talk about tummy tuck incisions, we talk about two incisions, right? One is the one that's that's the lower belly, right? The one that comes down here. And then, of course, the one that is around the belly button, right? Those are the two incisions that come with the tummy tuck when we're talking about a full tummy tuck. If we were to talk about a mini tummy tuck, then you wouldn't have one around the belly button. You only have the one around the lower belly, okay? But every other tummy tuck other than that full tummy tuck, extended tummy tuck, is definitely going to have at least these two incisions. And then if you go for like that really big tummy tuck that we call the Fleur-de-Lis, that's the one that we use for our massive weight loss patients. Then you're going to have the one that has, yes, around the belly button and the lower belly, but also one that comes up and down this way. But again, that's only reserved for patients that have a lot of loose skin, typically due to massive weight loss. I'm talking about those patients that lost 60, 80, 100 pounds and just have a ton of loose skin, okay? All right, so what would I say makes a good tummy tuck versus one that's not so great? And specifically, what about the incisions makes it a great tummy tuck, right? Because the number one reason that I hear from our patients and our followers that they don't want to do a tummy tuck is the scar, right? It's always a scar. And so I've been, kind of fighting through this for years and years because I always say that, if you're going to need to remove loose skin, then the best way to do that is the tummy tuck, and you should always do your tummy tuck first, right? You should do your tummy tuck before you get your BBL, so you have the best results of each of them. And so then we always get the patient to say I don't want to, I'll tell them hey, you have some weakness to your muscles of the belly, you have some loose skin, you have some muscle separation or diastasis, you should really do a tummy tuck, and you should do that first. And then, of course, inevitably we get the patient to say Doc, I don't care, I don't want the tummy tuck because I don't want that scar. And then I say, well, your belly's not going to look very good with lipo alone. And they're like, I'm willing to take the risk, okay? But here's the thing. I think people are scared of the scar because they've seen some terrible scars, right? But the way that we do the tummy tuck, you have beautiful incisions and very easy to hide places, okay? So what are the keys, right? Let's start actually with the belly button. So I'm going to start with the belly button here. And so some of the complaints that I've heard are that, hey doc, the belly button doesn't look natural, and I've seen a lot of tummy tucks where the belly button just kind of looks like a slit up and down, almost like a coin slot at a vending machine, right? And yeah, and I've seen that, and I definitely agree. You have a belly button that looks like one of those slots at the vending machine, that does not look natural at all, right? Like all natural belly buttons, they have some roundness to them. So they're not going to look just like a little, line straight up and down, okay? So I agree, that definitely needs to be avoided. So we're going to avoid just a little line that's up and down. So then what's the next step? All right, so what does a belly button look like? Well, a belly button typically looks like either kind of a little bit of an inverted U with some hooding towards the bottom, or like a little bit kind of like an oval or almost diamond shape, okay? That's what a natural belly button looks like. And so those are the types of shapes that we want to create. But that's only the first part. So the first part is the shape. So the shape, you don't want it to be a slit. You don't want it really to be a perfect circle usually. You want it to be more of an oval shape or a little bit of that diamond shape. It's a little bit like this, kind of diamond shape, somewhat like that, okay? But with softer curves. And then, so that's step number one. So how do you do that? And then step number two is, where do you want the incision? Well, if you put the incision very superficial, then that's going to be a very obvious incision, right? That's going to be one where you can see. Not only that, but that type of incision has a pretty high chance of keloiding in those people that are predisposed to keloids, okay? And so you want to try to tuck in that incision as much as you can. So if you're able to kind of tuck in the incision, then it's not so visible from the outside. Not only that, but it's actually, and I don't know exactly why, but there's less chance of it keloiding when it's a little bit tucked in. Okay, perhaps because there's less tension on it. Okay, so how do you do that part of it? So we go through quite a few extra steps in order to achieve that. So when we're doing the tummy tuck and we kind of release the belly button from all the surrounding tissues, right? And then we lift everything up. Of course, we then go ahead and do the muscle repair, and then it's time to work on the belly button. So what do we do? First of all, certain patients may have like a very long belly button. If the belly button is too long, then it's going to, once everything's said and done and you don't do anything about that, it's going to appear too superficial, okay? So if you have a patient with a long belly button, you kind of want to either tuck it in or shorten the belly button. You can do this in several ways. One way is you can actually, cut it, right? You can cut some of the belly button if it's very, very long and it has enough skin. Another way to do it is to, when you're doing the muscle repair, to kind of bury it in a bit more as you're doing that muscle repair, okay? But then how do you make sure that it stays there? And that's one of the keys of what we do here at Pure. So we have our belly button, right? We have our kind of oval shape or diamond shaped belly button, and we've done your muscle repair, which kind of comes all the way from top to bottom. And then we put some stitches on the inside here, here, and here, okay? To hold that belly button down and in place, to make sure that we have an innie type belly button and that the incision ends up towards the inside, okay? So these 3 stitches hold that belly button in place. They keep it make it deeper basically, and they keep it in that position, okay? So that's one of the key things that we do here. And so then when you go to then, start putting everything together, and you make your incision, your little hole in your belly flap to then bring out the belly button, that little hole isn't going to come in, right? Because this is attached low and deep. So it's going to come in, and so then that final incision ends up being more on the inside and less visible from the outside, okay? And then it also creates that kind of natural hooding that we all have in our belly buttons, where everything kind of folds into the belly button, okay? So that is a key thing there. It's a technique that we do here at Pure and that we've been perfecting over the years, and it looks really, really beautiful, really natural looking belly buttons here. Okay? All right, so that's one. So that's one of the dead giveaways for tummy tucks, right? So people are like, I don't like the scar, especially the belly button. If I want to wear a two-piece, it's going to be obvious that I had a tummy tuck. Well, now if you come here to Pure, you have this type of belly button repair, okay? Now, the next one is, of course, the lower belly incision. So when I'm talking about the lower belly incision, I mean the one that kind of comes down here, okay? All right, again, there's also a technique to this. First of all, you want to make sure that that incision is pretty low, right? If you make it too high, then it's going to be very hard to hide. You're not going to be able to hide in a swimsuit, especially like a two-piece bikini, if you make this incision too high. Now, one of the things people may not know, though, is that you can't make it too low. If you make it too low, well, sometimes for some patients the skin may not reach, but if you make it too low, that may affect then the pubic area. So you have to be careful there. Like it may lead to like problems with the lymphatic system in the pubic area. So you can't make it too low. Okay, so it has to be just right. All right, like Goldilocks. Okay, and so there is actually a very specific measurement that you have to take from basically where the vagina starts, okay, to where your incision is going to be, and this distance has to be approximately 7 centimeters. Okay. So if it's more than centimeters, your incision is going to be too high. If it's less than centimeters, then you may run into issues with the pubic area. Okay, so that's the average. Now, of course, there's a little bit of give to that. You know, some patients might be very, very tall, so maybe you can go like 8 centimeters. Some patients might be a bit shorter, so you go 6 centimeters, right? There's a little bit of give to that, but not, nothing crazy, right? You're never going to go 3 centimeters, and you should never go 10 centimeters. That's going to make incision either too high or way too low. Okay. And then the next thing is, okay, so you want to start with incision that's low, so it's going to be easier to hide. But then what about, then you have to think about the shape or the curvature of the incision, right? So what I've seen a lot, and honestly, I don't like it at all. And I don't know why surgeons out there do this. For me, it makes no sense. But I've seen a lot the straight tummy tuck incision. The one that just kind of comes, sure, you're doing it at the 7 centimeters, but it comes straight across like this. I don't like that incision at all. Why? For 2 reasons. Number one, it does kind of tend to make the tummy tuck look more boxy when you do that, but not necessarily. If you do a good lipo, maybe it doesn't do that, but it can do that. And number two, it's impossible to hide, right? If you're wearing a swimsuit that kind of comes up here like this, part of it is going to pop out the swimsuit. So if you have these incisions that go straight, that are straight incisions, it's very, very tough to hide. You can't hide it in the underwear, you can't hide it in a swimsuit. There's always going to be a portion of it that kind of pops out the side of the swimsuit. Okay? So I don't like that incision at all. What I think looks great and it's easy to hide is what I like to call the nice gentle curve, okay? Or kind of like the smile tummy tuck, okay? So you want to have, yes, the bottom here needs to be at the 7 centimeter mark so that it's just right, but you want it to kind of follow that line of the swimsuit, right? You want to have that nice gentle curve, that smile tummy tuck, so that when you place the underwear or the swimsuit, that entire incision is right at that line where you'll be placing the swimsuit. And therefore, you're going to be completely hidden. So if you have the beautiful tucked in belly button, plus that smile incision, you can wear a bikini all day and nobody will really know. Okay? And at the end of the day, that's what it's all about. So, how curved you make the smile, that's going to very much depend on the patient. Not every patient is the same. And that's why, all these surgeries, they need to be tailored to the unique foundation of that particular patient. It's not cookie cutter. And also, not only the patient's foundation, but also what they like to wear. So there's some patients that like to wear bikinis that are a little bit straighter, right? They're never completely straight, but a little bit straighter. And then there are some patients that like to wear kind of bikinis that kind of hang up here, right? And so you have to, plan it with the patient. Sometimes the patient can come in and wear something that they really like. And that way you can plan the incision so you can place it exactly as it pertains to them and the type of bikini they like to wear. Okay? But for the most part, the gentle curve, the nice smile, that's where you want to go. And for the most part, you want to avoid that straight incision there, because that's, I think, the toughest one to hide. All right? Now, I mentioned here that our tummy tucks are not boxy. And I've seen a lot of boxy tummy tucks out there. Okay? How do we prevent the tummy tuck from being boxy? Well, that's where the liposculpture portion of it comes in, right? So we do lipo all along these areas, all along the flanks and the waist, all along here, all right, to cinch in that waist and to bring out the curves. We're also doing the muscle repair pretty tight. That also helps us cinch in the waist, okay? And sometimes if we have to, we'll even do lipo up here, up in these areas, you know, underneath the armpit, in the lateral breast area. Okay, all of that to contour the body so you have that nice curvy look to your tummy tuck. Okay, and we can do one more thing which you may not even think of, but it's becoming very, very popular. We're super excited about it. We did quite a few cases like this last year, and we're looking forward to doing a lot more this year, which is fat transfer. That's right, fat transfer to hips. Okay, fat transfer to the hips at the time of your tummy tuck. This is a terrific, terrific option if you want to have that beautiful, smooth hourglass shape. All right, because there are many patients that actually come with something more like this. And I'm sorry, I don't have a great eraser here today, but
it's behind the board, though.
It's behind the board. Yeah, okay.
Should be.
Here it is.
Okay.
There we go. It's still not a great eraser, but okay. All right. So as opposed to having that nice gentle curve, we have patients where it kind of comes out and then, ooh, that's exaggerated, but it comes in a bit, kind of like that. It's a very exaggerated drawing of a hip dip. But the issue is that when we do a tummy tuck on its own, that hip dip is going to remain, right? So if you have a hip dip and you want more of that smooth, gentle hourglass shape, then a great solution to that is to do a fat transfer to the hips at the time of your tummy tuck. And we can do that because here in Florida, even though we have our limits, we can still remove 1,000 cc's of fat via liposuction at time of tummy tuck. And typically for hips, you don't generally need more than 500 cc's per side. So we can divide that up. 500 cc's here, 500 cc's there. Okay, and that's going to help fill out the hip dip. And so now that's really going to accentuate that beautiful hourglass shape. Okay? All right, I've talked a lot, but hey, it's been a month, all right? And I'm happy to answer any and all questions.
There are so many, I don't know where I should start.
All right, so let's go. Let's get started.
Well, from the first one.
All right.
Okay, how can we get rid of the Ken doll bump 1 year post tummy tuck? It's most like fluid. She asks. Ken doll bump.
The Ken doll bump. Got it. Okay, so what you're saying, okay, it took me a little bit.
Oh!
It's the suprapubic area, right? So when she says the Ken doll bump, she's saying when there's swelling and inflammation in that suprapubic area, some people refer to it as the fupa, right? Okay, so first of all, when you do a tummy tuck, that area is going to get swollen, 100%. It's going to get swollen 100% because it is the most dependent part of the trunk, of the body. So all the swelling wants to accumulate in that area, and then it takes a while for that swelling to go away. And by a while, I say it could easily take 6 months, 8 months, even a year. Okay? So part of it is just to be patient. Now, if it's been a year since surgery and that area hasn't gone away, then potentially two things happen, or one of two things happen. One, there was just there's a lot of fat there to begin with, and that fat wasn't taken care of at the time of the tummy tuck. So that's another thing that can be done at the time of tummy tuck, is to either do liposuction or direct excision of fat in the mons or suprapubic or fupa area. Okay, so that is a very, very important. So if you have a prominent mons to start with because there's excess fat there, certainly let the surgeon know so that they know that you need to, either do liposuction or directly, since we're making the incision, directly remove the excess fat from that area.
Okay. So the second question, room. The fat transfer to the hips, it's used with ultrasound just to be safe.
So the good news is that you don't need ultrasound for fat transfer to hips, okay? And so why is that? So first of all, why do we use the ultrasound in the BBL? So we use the ultrasound when we're doing the fat transfer to the gluteal area, okay, to the central buttock area, and we do it specifically when we're placing the fat over the gluteal muscle. Okay, the gluteal muscle only comes to about here. It does not extend into the hip area. So there is no danger in the hip area, that you're outside the danger zone. The danger zone is only where that gluteal muscle is, because if you inject into or deep to that specific muscle, that's when the fat can get into those large veins and then become a fat embolism and go to the lungs and cause serious problems or even death, okay? But once you're outside of the area of where the gluteal muscle is, which is the hips, okay, that is not a danger zone. That is a safe zone. And so in that safe zone, there's no need for additional imaging with the ultrasound.
I did a gastric sleeve and had a baby. How long should I wait to do a mommy makeover?
So I'm not sure which came first, but it's okay. But if you did gastric sleeve and then had a baby, then you want to wait 6 months. Okay, so you want to wait 6 months after having the baby to have your mommy makeover. Now, if you did it the other way around, had the baby, then had the gastric sleeve, so you want to wait. It's going to be similar. It's going to be maybe 4 to 6 months. But really, the important thing after having a weight loss surgery is that you want your weight to stabilize. So typically, what happens after you have weight loss surgery? So you have weight loss surgery. This is your weight. This is time. So the weight starts to come down, but then you hit a low point, then come back up a little bit, and then plateau. Okay? So you want to make sure you're in that plateau stage when you have your mommy makeover. And that usually takes about 4 to 6 months.
Do I gain weight for a second BBL? I don't have enough fat. My butt seems flat and no projection.
Right. So if you need another BBL and your butt, already is looking pretty flat, yeah, we need fat to work with. So it's quite possible that you may need to gain some weight. Okay. What I would recommend is that we do an evaluation. So I highly recommend that you send your virtual consult, which you can do online through our website, www.puroplasticsurgery.com. And there you're going to get a questionnaire and you're going to send some photos, and that way we can evaluate the photos and determine potentially how much weight you need to gain. Part of the questionnaire is going to be your height and current weight, and that's going to give us your BMI, and then from there we can kind of guesstimate how much more weight you have to gain to get to an appropriate BMI and have enough fat for your round 2 BBL.
I'm 51 years old and would like to have 360 lipo and a BBL.
Okay.
Have you performed this surgery at this age?
So I have, but that was a few years ago, because my current age limit for BBL is 50. However, Dr. Vidal, Dr. Wigeriff, which are my partners here, other surgeons here at Pure, they will do BBL up to 55. Okay, so yes, you are a candidate for them, and it can certainly be done. So I highly encourage you to send in your information.
Okay, what's the BMI for a mommy makeover? 44 BMI and lost 320 pounds.
Wow. First of all, congratulations on the weight loss. That is huge. You lost 320 pounds.
320.
But your current BMI is still 44. Is that what I'm reading? Okay. Okay. So it seems like you've done a great job so far. You've gone a long way. That is extremely challenging. So congratulations. But the max BMI for me for my makeover is 30. And the max BMI for Dr. Vidal and Dr. Wigeriff, I believe, is 33.5. So you're already well on your way, but you're gonna have to keep going. Okay, you have to keep going to get that BMI at least to around 34, so 33.5, to then be considered for surgery. Which after losing that much weight, for sure, you're gonna have a ton of excess skin in your body, and therefore you're gonna be a candidate for a lot of our massive weight loss procedures, which are typically like a breast lift or breast lift with implants, tummy tuck, sometimes a back lift, arm lift, and thigh lifts.
Correct. 230.
Okay.
230.
Okay.
Okay. Can I get lipo 360 with a skin removal without having drains?
So lipo 360 with skin removal. All right.
Mini tummy tuck?
Yeah, the tummy tuck. Yeah. So I do all my tummy tucks with drains. So I use drains for my tummy tucks. I use 2 drains typically. And there are drainless tummy tuck techniques. And fortunately, we have a great surgeon here who's basically an expert in drainless tummy tucks, Dr. Wegerf. And so if you're considering a drainless tummy tuck, then please go ahead and send us your information, and we'll get you in contact with a coordinator for Dr. Wegerf, who is truly excellent at the drainless tummy tuck technique.
Would it be possible to get a BBL and chin fat removal at the same time with you guys?
Yeah, definitely. So that's one of the most common add-ons that we have for BBL. Would be the additional chin lipo, or we can do chin lipo with what's called face tight, which is a device that we use to help the skin retract and for that sharper angle between the chin and the neck. So yeah, very, very popular add-on. We can certainly add that onto your BBL.
Okay. Look, my BMI was 30 when I booked my surgery with you.
Okay.
And now it's down to 26.
Okay. All right.
Should I maintain ready weight loss, or is it okay to continue losing weight?
So for what surgery though, do we know?
No.
Okay.
But I can tell you, Kitania, tell us your surgery.
All right. So certainly, if it's gonna be for a tummy tuck, then yeah, I will want you to get to your goal weight, and then have your procedure, right? Then have your tummy tuck.
BBL.
If it's for a BBL, then I definitely want to kind of basically take a look at everything, and because I don't want you to overdo it, right? Remember, we are going to need some of that fat for your BBL, and also, if you lose weight very, very rapidly, you may end up with some loose skin. Okay, so we want to be careful with those 2 issues. So I probably want to get updated photos to see how you're doing, how you're looking right now, to determine whether it's a good idea to continue to lose weight or not prior to the BBL.
Okay. How long does the pain from a BBL last?
Good question. So the short, non-satisfactory answer is it depends. Okay, because every patient can be very, very different. But I'm going to tell you what the average is, right? So for the most part, for most patients, the kind of intense pain after BBL lasts for 48 hours. Okay, 48 hours is more intense than the first 48 hours. Coming right out of surgery, the first night, maybe the second night, and then after that, it drops off. It drops off very, very quickly after that. And I'll tell you, that's probably the average for most patients.
Okay. If you can explain about the consultation process. There's a patient that's asking about video consultations and in person, if that's possible.
Yeah.
At TikTok. That's on fire,
yes,
by the way.
TikTok's still with us. That's right. We weren't sure for a little bit there. But yes, okay, so the consultation process. So first of all, what type of consults do we do, and how do you gain access to them? All right, so we actually do 3 different type of consults. One is what we call a virtual consult, okay, and that one is done through the website. And so in order to do a virtual consult, you go to our website, you go to www.puroplasticsurgery.com, and you hit a button there that says either start your journey, book your surgery, or virtual consultation, okay? And from there, it's going to take you to a questionnaire. You're going to fill out the questionnaire, and then it's going to ask you for photos. You're going to send us at least 3 photos, minimum 3 photos. That's all going to come to one of our coordinators. Then we'll be able to evaluate your questionnaire and the photos, and the coordinator will reach out to you with the recommendations, okay? And then from there, you can get a quote and book the surgery, all right? That's the first way, and probably the most common way. The second way of doing a consultation is what we call a video consult, okay? So video consult starts off the same way, exactly like I just said. You still go to the website, you still go to the virtual consultation, you still fill it out. But when the coordinator calls you, you tell them like, hey, I want to do a video consult. And so then they'll schedule the appointment to do the consult with myself or one of the other surgeons through a Zoom-like type video consult. Now, this type of consult works well if you want that for a lot of our out-of-town patients, right, who can't make it here in person. And then the last way to have a consult is the in-person consult. So the in-person consult can start in a similar fashion as before, or you can call us, okay, 305-230-4326. So you can call us, and then we can set up the in-person consult. That's kind of your more traditional consult where you come in and you speak with the staff, and then you speak with the surgeon, okay? So 3 different ways. Some people love the whole virtual consult aspect. It's quick, it's easy, it's very efficient, especially for those that are out of town. If you're in a different state, different country, that's probably the easiest way to do it. But I do highly encourage everyone to go to our website, okay? pureplasticsurgery.com. Okay, www.pureplasticsurgery.com. Okay, and that's where you're going to have access to the virtual consultation, or just as the first point of access, right? Once you fill that out, we'll be able to receive your information, and a coordinator can reach out to you. She can give you a ton of information about the surgeons, about procedures, etc. They're extremely knowledgeable y hablan también español. Everyone here is bilingüe. Hablamos inglés y español, English and Spanish, okay? All right, and from there, then you can decide whether you're happy with the virtual consult or whether you want to have a video consult or an in-person consult. All right, the other way to contact us is with the phone number, and that I'll put up here, 305-230-4326. Okay, and then that's a great way to get in touch with us, especially if you want to go kind of straight to that in-person consult, you can do that. Okay.
Last question.
Yes.
When safe to get massages after surgery? She's talking about tummy tuck.
Great. It's safe to start actually as soon as the next day, like the day after surgery, okay? But of course, you always want to do this with a professional post-surgery lymphatic massage specialist. And let me point out the areas, right? So when you do a tummy tuck, you can start the next day, and you probably should start the next day. But the massage is going to be along the areas we do the lipo, which is kind of all these areas that we talked about here. So the flanks and the waist area, okay? And they're also going to massage the lower back, okay? Why the lower back? Because that's where we get a lot of muscle spasming for having to walk like this at the beginning, okay? So at the beginning, after a tummy tuck, you're going to walk all kind of hunched over because there's going to be a lot of tension in that belly area. Okay, and that can cause some spasming of the muscles of the lower back. And so the massages help relieve some of those spasms and relieve some of that tension. It makes you feel a lot better. Okay, so you can start as soon as the next day, a massage along the flanks and the waist and the lower back. Now, where you're not going to massage, okay, that early on, you are not going to massage here. Okay, no front belly massage up until 2 weeks post-op. Okay? After 2 weeks, then it's okay to massage here because you've gone through some initial healing time. Okay? But within the first 2 weeks, no massage in this area because we want to give those incisions the time to heal without any intervention. All right? Okay. All right. Awesome. We did it. All right. First hump day of 2025. of many, many to come. So, as you know, we are here every single Wednesday, hence the name, Hump Day. So we're here every single Wednesday, typically somewhere between 4 and 5 p.m., going over all the plastic surgery topics and answering all your questions, all right? And I look forward to seeing all of you next week on Hump Day with Dr. Alex Earle. All right, I'll see you then. Take care. Ciao.